I do want to talk a little bit about a couple of other initiatives around planning for the surge. One of the core functions of the COVID-19 Response Command Center is to expand our existing capacity to serve people once the surge arrives, and they are working on a variety of initiatives to ramp this up. First of all, reducing pressure on the system overall, in part by issuing more than 30 orders or guidance aimed at keeping folks who don't absolutely have to be in the hospital out of the hospital, making it possible for clinicians to engage with one another in more flexible and management-specific ways, and also in developing additional capacity so that the Commonwealth has the ability to work with our colleagues in the healthcare community to ensure that we have the right kinds of beds in the right places to serve people once the surge arrives. This week, the COVID-19 Response Command Center is establishing a dedicated skilled nursing facility, a set of dedicated skilled nursing facilities to care for older adults who are infected with COVID-19. This is one more way to relieve pressure on hospitals and maintain acute care capacity for patients who are critically ill. This will allow hospitals to move more patients into the recovery phase and out of hospital beds and into a safe, professionally staffed setting. We've already started this effort with the Beaumont Rehabilitation and Skilled Nursing Center in Worcester. We all understand that this is a disruptive activity for current residents and their families, and in many cases also for staff. And our teams are making every effort they can to make temporary relocations as smooth and as comfortable as possible. And we're especially appreciative to the leadership and the team at Beaumont who have answered the call from the Commonwealth to be the first of these needed designated skilled nursing facilities. Beaumont will help us bring 300 skilled nursing facility beds online in the Worcester area, and they anticipate opening 150 of those beds by Thursday. We need to continue to create significant capacity so our most vulnerable population, should they get infected with COVID-19 and need acute care in a well-equipped and safe setting, will get it. We know this isn't an easy task, but without these designated sites, hospitals would have to discharge COVID-19 patients to any skilled facility with an open capacity, which could put the rest of the healthy residents and the staff at those facilities at risk. This step will help us avoid imposing a mandate on skilled nursing facilities to take COVID-19 patients from hospitals, and will have those facilities that are actually stood up to do this work much better positioned to do it well, to do it right, and to do it safely. The goal is to have about 1,000 beds available for older residents as we plan for the COVID-19 surge. We've also received federal approval from CMS to implement this program, and we'll continue to work this issue around the clock to increase our bed capacity to prepare for the surge.